Hi, welcome to our channel of IGNOU audiobooks. Indira Gandhi National Open University, School of Health Sciences, SOHS, Certificate Programs. Certificate in Home Health Assistance, CHHA. BHT 016 Basic Home Health Assistance. Block-1 Foundation to Home Health Assistance Program. Unit 1 Introduction to Home Health Assistance Program. 1.0 Introduction. Home health care is required for people who are physically or socially dependent on others because of their health problems. During the process of cure, it is important that patients maintain better quality of life. Home health care providers take the responsibility of some of the physical and emotional needs of patients in this unit. We will discuss about the health care delivery system in India. Hospital care, meaning of home health care. Important terms which you will be using throughout the material, qualities of a home care providers and health roles and responsibilities. 1.1 Objectives. After reading this unit you will be able to narrate the meaning of home care, explain the health care delivery system in India, describe the objectives and strategies under National Health Mission NHM, and the health programs under its ambit. Describe the qualities and skills of home care providers and explain the medico-legal and ethical issues in health care. 1.2 Health care delivery system in India. Constitution of India mentions that health is the responsibility of state. Health is a fundamental human right. Thus the state authorities have responsibility for the health of its people. The growth and development of a country also influences the healthcare delivery system of a country by change in its social, economic, political, and environmental factors. India has created a vast public health infrastructure. Let us briefly read healthcare delivery system in India at center. A strong public health infrastructure is required for translation of resources into outcomes in terms of prevention of morbidity and mortality and out-of-pocket expenditure by providing quality healthcare services to rich and poor with equity. Primary health care is best way to provide health services to the community. The primary health care is provided in India by a network of subcenters, health and wellness centers, and primary health centers. Let us now read these concepts as explained below. 1. At the center. 1. The Ministry of Health and Family Welfare, Mohanfu. 2. The Directorate General of Health Services, DGHS. 3. The Central Council of Health and Family Welfare. 4. At state level Fig. 1.3. 5. At district level Fig. 1.4. Fig. 1.1. Organogram at the center. Fig. 1.2. Organogram of Ministry of Health Family Welfare. Fig. 1.3. Organizational structure of health and family welfare, state level. 1.2. 1. Health and wellness centers. Health and wellness centers have been established under Ayushman Bharat Yojana, Pradhan Mantri Jan Dhan Yojana, PMJ, which is a national initiative launched as a part of National Health Policy 2017. In order to achieve the vision of universal health coverage, UHC, it focuses on providing increased access to quality of healthcare, free medication and diagnostic services for people with low financial status. The scheme focuses on poor, deprived families and identified as per the latest socio-economic caste census (SECC) data. Entitlements of PMJ include pre- and post-hospitalization expenses, defined transport allowance per hospitalization. Patient can avail services from anywhere in the country. Services from any empaneled public or private hospital. Cashless insurance. Benefits of PMJ include regulation of healthcare and accreditation of health facility. Incentivize hospitals to expand in rural areas. Package rates 15 to 20% lower than central government health scheme. Performance-based payment system. ICT use for free flow of data and tracking of transactions. Mapping of beneficiaries, tracking shows, and healthcare providers. The health and wellness centers have been established to deliver comprehensive, preventive, promotive, curative, and therapeutic, primary care for all, especially for the underprivileged and vulnerable people who cannot afford medical treatment due to the overpriced medicines and investigations. The health and wellness centers also provide free diagnostic services and give access essential drugs free of cost. 1.2.2 Subcenters. Subhealth center, subcenter, is the most peripheral and first contact point between the primary health care system and the community. As per the population norms, one subcenter is established for every 5,000 population in plain areas and for every 3,000 population in hilly tribal desert areas. A subcenter is manned by an auxiliary nurse midwife, ANM, and male multi-purpose health worker, MPHW, M. 1. Health assistant, female, commonly known as lady health visitor, LHV, and 1 health assistant, male, located at the PHC level with the task of supervision of all the subcenters, generally 6 subcenters. Under APHC, the staff of the subcenter has the support of ASHA. Accredited social health activist, ASHA is primarily a trained woman, volunteer, resident of the village, married widow, divorced with formal education up to 8th standard, preferably in the age group of 25 to 45 years. The general norm is availability of 1 ASHA per 1,000 population in rural, whereas over 2,000 population in urban areas. Subcenters are expected to provide promotive, preventive, and few curative primary health care services envisaged under various national health programs. 1.2.3 Primary Health Centers, PHC. Primary Health Center is the first point of contact with a qualified doctor of the public sector in rural areas. A primary health center covers a population of 20,000 in hilly, tribal, or difficult areas and 30,000 in plains with 6 indoor observation beds. It acts as a referral unit for subcenters and refer out cases to CHC, 30-bedded hospital, and higher-order public hospitals located at sub-district and district level. A PHC provides a total of 6 hours of OPD services daily for 6 days in a week, besides a separate labor room for delivery of pregnant women. There are 6 beds available in the PHC for observation and stabilization of patients before discharge referral. The PHC also has 24 hours emergency services for appropriate management of injuries and accident, first aid, stitching of wounds, incision and drainage of abscess, stabilization of the condition of the patient before referral, dog bite, snake bite, scorpion bite cases, and other emergency conditions. Besides these, PHC also has specific role for preventive and promotive healthcare under all the national health programs. The allied facilities of laundry, transport with assured referral, dietary facilities for indoor patients and bio-waste management are essential for functioning of the PHC. The manpower present at a PHC depend upon the delivery case load. A staff of 13 to 18 including medical officer, staff nurses, pharmacist, lab technician, vaccine and logistic technician, ANM, lady health visitor, LHV, accountant, Safai Karamchari are essential to provide quality services. CHCs, sub-divisional hospitals and civil hospitals at the district level, provide secondary level of care and serve as referral centers for primary health care centers. 1.2.4 Community Health Centers, CHC. The community health centers, CHCs, constitute the secondary level of health care, provide referral as well as specialist health care to the rural population. CHCs act both as block-level health administrative unit and gatekeeper for referrals to higher level of facilities. All essential services at the CHC includes routine and emergency care in surgery, medicine, obstetrics and gynecology, pediatrics, dental and Ayush in addition to all the national health programs. Newborn Stabilization Unit, NBSU, Medical Termination of Pregnancy, MTP, facilities. Integrated Counseling and Testing Center, ICTC, blood storage and link antiretroviral therapy are the additional facilities available in CHCs. CHC is known as with regards to manpower, anesthetist and public health specialists are provided in addition to surgeon, medicine specialist, physician, and specialists of obstetrics, gynecology and pediatrics. A block public health unit at the CHC has a block medical officer, medical superintendent, one public health specialist and at least one public health nurse. The support manpower includes a dental assistant, multi-rehabilitation worker, cold chain and vaccine logistic assistant in addition to the existing staff. 1.2.5 Healthcare and hospitals. A hospital is a healthcare institution providing patient treatment with specialized medical and nursing staff and medical equipment. Hospitals are classified as government or private depending on the sources of income received, the hospitals as given below. A. Subdistrict, subdivisional, hospitals are below the district and above the block level, CHC, hospitals and act as first referral units for the Tehsil Taluk block population in which they are geographically located. They have an important role to play as first referral units, FRUs, in providing emergency obstetrics care and neonatal care and help in bringing down the maternal mortality and infant mortality. They form an important link between SC, PHC and CHC on one end and district hospitals on other end. It also saves the travel time for the cases needing emergency care and reduces the workload of the district hospital. A. Subdivision hospital caters to about 5 to 6 lakh people. Specialist services are provided through these subdistrict hospitals, and they receive referred cases from neighboring CHCs, PHCs and SCs. Besides the basic specialty, services like newborn care, newborn care corner and newborn stabilization unit, family planning, psychiatric services, physical medicine and rehabilitation services, geriatric services, accident and trauma services and integrated counseling and testing center are also provided. Every subdistrict hospital should have a postpartum unit with dedicated staff to provide postnatal services, family planning services, safe abortion services, and immunization in an integrated manner. B. District Hospital, DH, is a hospital at the secondary referral level for a district with an objective to provide comprehensive secondary health care services to the people in the district at an acceptable level of quality and being responsive and sensitive to the needs of people and referring centers. The bed strength of a district hospital varies from 75 to 500 beds depending on the size Terrain and population of the district. Fig.1.4 Administration at district level. It is desirable that all hospitals provide super specialties and related diagnostic facilities in more than 300 bedded hospitals. The health care services include OPD, indoor and emergency services. Essential services provided through the SDHDH are general medicine, general surgery, accidents, and emergency services including poisoning and trauma care, general orthopedic, obstetrics, and gynecology. Pediatrics including neonatology and immunization, anesthesia. Ophthalmology, ENT, radiology including imaging services, dental care, DOT Center, Designated Microscopy Center, Ayush, Integrated Counseling and Testing Center. The supportive services in the form of diagnostics and other paraclinical services include laboratory services, X-ray, ultrasound, ECG, blood transfusion and storage. Critical care intensive care, ICU, is set up in hospitals with bed strength more than 50 beds. If the case load of deliveries is more than 75 per month, a postpartum unit is put in place to provide the postnatal services, family planning services. A district hospital also provides facilities of special newborn care units, SNCU, with specially trained staff along with provisions for patient safety, infection control, and healthcare workers' safety. The quality of services is ensured in clinics, laboratories, blood bank, ward unit, pharmacies, and accident and emergency services. The essential allied services in hospitals include medico-legal, postmortem, ambulance services, dietary provisions for indoor patients, laundry for linen, central sterile supply department, engineering and maintenance cell, security services including fire safety services, housekeeping and sanitation, medical store, inventory management, waste management, and medical record department including MIS. Power backup facility are the other requirements for the efficient functioning of any hospital. C. Tertiary care is provided by the specialty and super specialty hospitals located at the levels beyond the district hospitals. These are state-of-art centers of excellence that serve as referral centers for patients referred from district and sub-district level health facilities. These units also function as training centers for the manpower posted in district and sub-district hospitals. These hospitals have a range of department specialties like medicine, surgery, obstetrics and gynecology, and also super specialty units such as cardiology, etc. They also deal with specific medical needs like trauma centers, rehabilitation hospitals, children's hospitals, etc. A teaching hospital combines patient care with teaching to medical students and sometimes paramedics like nurses. All the hospitals have outpatient departments where the patients are examined on daily basis, given relevant advice, and are sent back. An indoor department is where the patients who need care round the clock are admitted. The intensive care units, ICU, are where serious patients with needs of highly specialized and intense care are admitted. Common support units include pharmacy, pathology, radiology, biochemical laboratories, dietetic and medical records. The medical facility smaller than a hospital is generally called a clinic. Hospitals are largely staffed by professional physicians, surgeons, nurses, and allied support staff like technicians for lab and OT, clerical staff, accounts personnel, and Safai Karamchari. The purpose of healthcare practice is to always care for the ailing and the sick, promote health interests and well-being and strive towards healing environments. The healthcare staff are committed to integrity in their work, compassion and empathy with patients, altruism or principle, practice of unselfish concern for or devotion to the welfare of others, learning towards continuous self-improvement and excellence and working in partnership with members of the wider healthcare team. 1.2.6 Professionalism. To sets the standard of what a patient should expect from his or her healthcare practitioner is an ideal. Healthcare practice is also about experiences, feelings, and interpretations of human beings in often extraordinary moments of fear, anxiety, and doubt. In this vulnerable position, professionalism puts the public's trust in healthcare practitioners. And professional integrity and honesty should be maintained to an extent to which the professional reputation and credibility remains assured and untainted. Compassion, competence, and autonomy are judged to be core foundational values in the practice of healthcare. An extremely high degree of competence not only technically, but also on ethics, skills, and attitudes. Understanding of human rights and health law is expected and required of health practitioners. With the changing scenario of health sector, autonomy of patient is gaining a widespread acceptance and the autonomy of the care providers is being moderated by governments and other authorities. The ethical and moral duties expected from the health practitioners also sometimes leads to effacement of self-interest on the healthcare provider. The position of care providers is unique since the situation of illness itself puts the patient in a uniquely dependent, anxious, vulnerable, and easily exploitable state, where the patients trust the care provider with the state of relative powerlessness. All the more, the care and knowledge he offers at the service of the sick, the trust relationship strengthens. Thus, the health care provider must be very careful in handling the relationship of trust with the patient and his/her family. Also, the knowledge gained by the health care provider during his interaction with the patient or his family involves certain invasions of privacy, thus, should not be used primarily for personal gain, prestige, or power. Thus, to provide quality care through all the health facilities, Indian Public Health Standards, IPHs, for building, manpower, instruments and equipments, drugs and other facilities, etc., have been prescribed to provide basic primary health care services to the community and achieve and maintain an acceptable standard of quality of care. To ensure accountability, all facilities have functional Rogi Kalyan Samiti, RKS, and also the Charter of Patients' Rights displayed prominently at the entrance. A grievance redressal mechanism has been put in place at all the facilities to address the grievances of the users. The launch of National Health Mission has provided the opportunity to have a fresh look at the functioning of health facilities with an objective to strengthen them for service delivery with quality and accountability. 1. 3. Importance and scope of HHA in healthcare. A home care assistant is a person who has gone through the training and obtained a certificate from an authorized organization and has developed skills in looking after sick and dependent people. In the following text, we will discuss some of the qualities of a home care assistant as given below. 1.3.1 Home health assistants should have the following qualities. Fig. 1.5. 1. Develop a caring attitude. When you meet a person who is sick, dependent, and lonely and requires home care, you must greet him/her and meet him/her with a smile. It makes him/her feel good. Talk to person and show your intentions to help and develop trust and two-way communication. 2. Be dependable. While you are talking to the person, ensure that his problem is given importance. You are listening to him. If the client feels hungry, you get food for him. If he wants to pass urine or stool and needs help, you provide the assistance. Suppose a person is going to fall, you immediately protect him from the fall. The patient should feel secure in your company and should depend on you for taking care of his/her needs. It means you need to understand clients' needs and act accordingly. 3. Be considerate. A patient may have physical, emotional, or neurological problems. He and his relatives may not understand things as you expect them to. For example, you may ask the patient to eat food as it is getting cold, but he/she may not understand why there is need to hurry when he has an ulcer in his mouth and is not able to chew properly. At this point, you should ask the patient, is the hot food hurting him because of the ulcer in your mouth? This concern will be appreciated by the patient. 4. Have knowledge. The patient and his family will expect you to have answers to all their questions and problems. You should be able to answer all their questions related to care given to the patient. However, if you are not aware of certain symptoms, tell them truthfully that you do not have the answer to their questions. If possible, try to find out what information they want or refer. 5. Be trustworthy. As a home care provider, you enter a house where people might be afraid that you will come to know all the secrets of their family. Do not tell any information about the sickness of the patient or any other matter or event happening in the family to others. This will help in developing trust with the family members. 6. Be a good observer. As care provider, you should note any change in patient's condition. It can be difficulty in breathing, high or low pulse rate, high or low BP, tight abdomen, ulcers in mouth, redness of skin on pressure points or any small change. Make observations and assess the needs of the client. 7. Be a good listener. You should try to listen to the patient's problems and difficulties the family members face due to their relative sickness. Don't interrupt them when they are talking. 8. Be respectful. As a caregiver, you need to show respect to the patient and his relatives. They have certain beliefs, values, and feelings which you should respect without questioning. Respect and dignity of the patient and family members must always be maintained. Respect the social and cultural values and beliefs. 9. Be resourceful. When a patient tells that he is not able to buy medicines or a wheelchair, you should be able to find out agencies that can help him. You can help the family or patient to use some thing which is available at home, for example, clean cloth for bandage or tea kettle for steam inhalation at home. Things are also available on rent basis in the market. You would also be given a task to visit a shop whom these home care appliances are so that you prow and also explain your patient to procure. 10. Develop communication skills. As a caregiver, you should talk clearly, in small sentences and in a language that the family members and patient are able to understand. Your body movements should also communicate calmness to the patient. 11. Develop empathy. Empathy means putting yourself in the other person's position. For example, a patient who is suffering from paralysis cries that he cannot even go to the toilet herself, as he obviously has a very difficult life. You must try to put yourself in his position and understand his feelings. Help by counseling or talking and relieving this discomfort. 12. Maintain courtesy and dignity. As a caregiver, you must be polite and courteous to patients, family members, and visitors. You must call people by adding title like Mr. Narendra, Mrs. Aarti Devi, or Ms. Bharti. Before carrying out a procedure, explain it in detail and add the word please in case you want to make a request. After finishing the procedure, you must say thank you. 13. Be honest. You must be truthful, sincere, and show genuine interest in the patient's problems. If you have made a mistake, you must report it to the patient and the family members truthfully. For example, you forgot to give medicine at 8 a.m. to the patient as you were busy feeding him and now it is 10 a.m. You must tell this to the patient and family members. It is good to be completely honest with them. 14. Be cooperative. As a care home assistant, you should be able to cooperate with patients and family members. For example, if one of the children in the family is very sick and all the members are busy, you may have to attend to all the needs of the patient alone, depending on the situation. 15. Keep good health and be neatly groomed. When you go to your patient's client's house, you should be neat, clean, and well groomed. The care provider will be able to give good care to patients only when he is in good health himself. Feeling and looking healthy is very important. You will be learning about dressing it and grooming. 16. Apply scientific principle while giving care. Maintain scientific principles of aseptic technique, for example hand washing and use of clean or sterile articles to prevent further infection. 17. Be health educator. Impart health-related education as and when possible to family member and patient. Fig. 1.5. Qualities of home care provider. 1.3.2 Roles and responsibilities of home care providers. As a home health assistant, you have certain roles and responsibilities. Roles are the functions that are expected from the care providers. Responsibilities means that a person is able to perform the activities for which he has been prepared for. Roles and responsibilities as given in Table 1.1. Care provider. An educator. Counselor. Table 1.1. Role and responsibilities of home health assistant. Skills as a care provider. Learn how to check the temperature, pulse, respiration, and BP. Develop skill in providing personal hygiene. Learn how to prevent infection to self and family members. Learn the skill in feeding dependent patient point. Learn the skill of giving medicines and providing other procedures. Help promote physical comfort, lifting and moving the patient and collecting specimens. Provide safe environment. Specific procedures as per the need of client. Adapt to home situation and be resourceful. Skills as an educator. Know basic causes of a problem point. Develop skills in helping patients and family. Develop skills in communicating verbally and non-verbally. Assess health education needs and educate accordingly. Do not give too much of new information at a time. Encourage self-help and answer their queries. Skills as a counselor. Develop basic counseling skills, comforting, reassuring, helping patient face reality or with other psychological problems. Maintain confidentiality at home, workplace, and community. Identify when to refer a patient to a hospital. Help in problem solving by helping them to decide for themselves. 1.3.3 Common conditions for providing home care. Home health assistant care provider is required when the person is not able to look after her himself and family members are also unable to do so. Situations where home care is provided by trained home health assistant are as follows: emergency and accidents, first aid, acute illness before hospitalization or after discharge, long-term illness or chronic illness, convalescent care, elderly members in the family, small family or patient alone, palliative or terminally ill care, follow-up care after discharge from the hospital-specific procedure, like bed sore dressing, colostomy care, and urinary catheter care. 1.3.4 Code of Conduct, Do's and Don'ts. Home-based health assistants should be careful by avoiding common mistakes listed below. Not putting side railing or pillows on the sides of confused patient, and he/she falls. Causing burns to the patient by giving hot water bottle when it is too hot. Dentures, artificial teeth of a patient break when dropped by the care provider. Patient complains of chest pain and breathing difficulty and care provider does not refer the patient to the doctor or health center. Similarly, these may be various other common mistakes which can be prevented if early measures are taken. 1.3.5 Ethics and medico-legal aspects. While working in home and community settings, it is important to take care of the ethical and medico-legal issues like privacy. Privacy in healthcare settings refers to people's right to control access to their personal information. People have the authority to determine what information to share, with whom, and how. All information a health care worker gathers during providing care has to be kept private by the healthcare provider. The patient has a legal right to this, however, the healthcare provider has a right to privileged communication in the interest of the patient or for the benefit of the community at large. Confidentiality. The concept of confidentiality includes both privacy and security and has been defined as either a tool to protect privacy or an act limiting disclosure of private matters. The intent is to ensure that individual health information is used for the intended purpose only, and that patient consent is required for any disclosure. Consent to treatment is the principle that a person must give permission before they receive any type of medical treatment, test, or examination. It can be implied, verbal, or written. A healthcare provider should take consent before providing care to its patient. However, when the patient chooses a healthcare provider, the consent is implied for care. All patients have right towards respectful care, attention to needs, empathy, autonomy, care, individuality, information, dignity are the 7 norms of respectful health care that should be borne in mind while providing care to the patients. 1.3.6 How to work in a community. Thus, to work in a community, the healthcare worker needs to be sensitive to the social and cultural setup of the people. The qualities of a healthcare provider that would enable them to work efficiently in a community are: understand the health needs of the community. The health worker will be able to make and implement plans better if they are able to understand the health requirements of the community. Well-versed with the socio-cultural structure of the community, the better understanding of the socio-cultural setup of the community will help the healthcare worker to design the strategies in accordance to the community beliefs and thus would ensure better implementation. Rapport with the community. A healthcare worker has to build rapport to convince the people in the community that all his actions are for the benefit of the people. This would increase the ownership of all his endeavors by the community and thus the implementation will be smoother and easier. Engaging the community leaders. The involvement of community leaders PRI members, Mahila Mandalis, self-help groups in the process of planning and implementation will improve the acceptance of the plans and will thus also facilitate their implementation. Involvement of the community leaders will also help in mobilization of resources wherever required. 1.4 Summary. In this introductory unit you have read about the meaning of home-based care providers, healthcare delivery system, National Health Mission, and various national health programs under the ambit of NHM. The qualities and responsibilities of home care providers have also been highlighted. We have also discussed about the common mistakes which should be avoided. We have also briefly discussed the patient's rights during care provision and ethical and medico-legal aspects of healthcare provision. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.